Recently, there was a proposition on the ballot in California to vote whether doctors should be drug tested, and it was voted down.
It's hard to believe. You know, you want to be loyal to your doctor for sure. But there are a lot of doctors who are on drugs and who drink too much.
And you don't want one of
healthcare
those to be treating you.
Right, it's a serious problem. I think drug testing isn't unfair. I think it's unfair not to do drug testing to the patients.
Well, maybe some people were afraid of giving doctors a bad name, or they didn't want to be disloyal to their doctor.
I think that's right.
But, you know, besides doctors, drugs as well as alcohol are also a problem for medical students and student nurses, it's come to light,
Yeah.
as well as college students. And they often indulge in alcohol and drug abuse.
Right. Well, we've got problems with a lot of people being unhappy with their lives. We all have some dysfunctional nature to our families as we're brought up. And when we get away, we get into college, whether it be medical school or nursing school or just college, there's a problem with drugs and alcohol.
Yeah, there
It's
certainly
widespread.
is. Well, you know, the prevalence of hazardous drinking does need further investigation, however, and we need to get at what is the cause, and is it due to personal problems, or the freedom of being away from home, or peer pressure, or the pressure from training?
Exactly. If that was a multiple choice question, it would be all of the above, because there's a huge issue in each of those domains. You know, we talked about the dysfunctional families, and when we have dysfunctional families, we have a lot of stresses that we take with us, and we lose our self-confidence and our self-image.
I think one of the things that's really important is starting when children are young, to teach them how to cope with stress so that they don't turn to drugs or alcohol when they're stressed out.
Right, and then you get into programs like what we have in medical school and nursing school, and it really becomes exaggerated because the training is almost inhuman in some ways.
Well, you know, when I was in nursing school, personally, I didn't see any students drinking or, you know, taking drugs or any of that. I mean, possibly it was happening, but I never noticed it. But it was a lot of pressure. I mean, we had to get up at 5 o'clock in the morning, which is pretty early.
Yep.
And we had to go work at the hospital. We had to take classes. Every weekend we had care studies, which were like a report, a paper to do every weekend.
Right.
So we really didn't have much free time.
Right. You know, and despite the fact that doctors are screened very carefully before they get into medical school, there's a real problem with this kind of stress because about 11% of medical students actually contemplate suicide, which ought to tell you something because most of these people are really pretty well balanced when they come into medical school or they couldn't get in. And then something happens to them that's a little bit more, and it's the same thing apparently with nursing students as well.
And two, I think sometimes the instructors or the professors are doing this power play thing, you know. It's
Absolutely.
like, I had to go through it, so you have to go through it.
Well,
and I'm not going to make it easier on you just
No.
because I had a hard time or I didn't get enough
Right.
sleep or what have you.
Right, and they kind of get together, and they figure that they are all in agreement that medical school and dental school and nursing school and chiropractic school should all be difficult because there's a lot to learn and people's lives are at stake, and so they try to have this authoritarian way of putting pressure on people. When I was an intern and a resident at Highland Hospital in Oakland, I was on call for 36 hours and off for 12 for months at a time, which means we're working more than 120 hours a week.
Boy, that's like a setup to be working, taking care of each other.
Well, well, that's right, but it leaves a lot of scars on the doctors and the nurses or people who are in training like that. So later in their practices, when they're actually out there treating people, a lot of this attitude leaks through because you get a little angry and grumpy with what happened to you in the training that you had. And then, unless you can forgive the people who did that to you, which is a little tough, you're going to carry that with you right through with your patients.
You know, one time when I was working in the OR as a student nurse, we got done with, you know, the surgery, and we were supposed to clean up the room. And this nurse that I was working with, I didn't really know her. I hadn't really spoken to her much of anything. I mean, it wasn't like we weren't getting along, but she was a nurse and I was a student, a lowly student.
Yeah, well, that's right.
And she just started throwing, they call them sponges, really. They're like gauze that they use in surgery. Throwing these bloody things on the floor and instruments and stuff and telling me to clean it up.
Oh, yeah. That's just uncalled for.
Like I was just this lowly student, and I was supposed to do that, and it was really frustrating.
It's humiliating.
Yeah.
Yeah, well, things like that shouldn't happen. But they do because of the way the system is, because of the way the culture is, because of the dysfunctional lives that we live in our culture. So this anger comes out, and here we are. And it's one of the ways it can be expressed.
Well, you know, too, I was thinking sometimes maybe if students could see what it was like to be an alcoholic. For example, when we're in training for being a nurse or for being a doctor, you do have patients that are alcoholics or that are having the DTs. And one time I had a patient that was in a coma because of her alcoholism, and she had cirrhosis of the liver, I think. And she was in a coma, and so they had a sitter, somebody that sat with her all the time to keep an eye on her. The family had done that. But I was the nurse on that wing, and so I would go in and help the sitter to turn her and so on and so forth, and to bathe her and everything, and give her medicines. And one day, she woke up. Well, she woke up, and the first thing she said was, "I want a drink."
Yeah, right.
And I couldn't help but think, what are we doing all this for? Why are we trying to save this woman when she just really wants to die?
Well, think of this poor, pathetic woman. She's addicted to alcohol for a reason. She had a dysfunctional life in a lot of ways and couldn't cope with it probably. And when that happens and you're saddled with that kind of situation, you become addicted to alcohol or to drugs, and then you can't get off of them. And if you don't get it, the anxiety level, the agitation gets so bad that you can't stand it anymore. And if it gets bad enough and the withdrawal is bad enough, you may have seizures or be psychotic. There are a lot of things that can go wrong. And so you're making a good point. We're spending all these hundreds of thousands of dollars on people who aren't going to be able to be getting off these drugs really very often. And what's it all about? We should be going back to looking at what are the causes for why people become dependent on alcohol and drugs, and do something about that rather than spending 10 times or 100 times as much after this has already become a problem, and it's very difficult to change.
So anyway, the other thing about people in the medical profession, there's a lot of temptation also because you're close to drugs.
Well, there's not for you and there's not for me because we didn't have those problems.
But if people are
if you need that, it's easy access. And so when we get back to this law, okay, that didn't pass in California because people voted it down, is really disrespectful to patients. Because when you're talking about saving lives or putting lives at risk because you're inebriated or can't think straight or you're on speed or, you're just not doing what you should be doing in a very serious situation, somebody's life's at stake. And we should be measuring that. It should be an automatic. If there's a problem, to the degree that there is, because let's face it, doctors have a big problem with drugs and alcohol.
And sometimes the students are even at risk.
Well, here we are. That's what the study showed.
But remember what happened to you when you were in medical school and the doctor made you take the sulfa drug and you were allergic to it?
Well, exactly. Well, there are things that happen to you because of the authoritative nature of the system that requires that sometimes you do things that are really stupid, like taking an antibiotic, which was what I was required to do as part of an experiment to measure excretion rates of that antibiotic. And I complained about it before. I said, I don't want to do this test, and I don't think anybody else should do the test either, because about 10% of us are going to have symptoms from it, and some unlucky person or two is going to have an anaphylactic reaction.
And guess who the unlucky person was?
So I wake up in the ICU, right, because it's happened to me. And it still took them 2 years to stop doing that experiment on future medical students. So when we're looking at problems like this, we have to be compassionate, certainly for the people who are suffering. We need to look at the cause for why they've developed this problem, and then we need to do something to solve those problems by being compassionate and thoughtful, and also checking up, because we can't put our patients at risk. It's just not right.